often write off the resulting red, flaky patches as a simple cosmetic case of dry skin. This diagram illustrates normal skin function. A healthy skin cell takes a slow, steady 28-day journey from the deepest epidermis layer to the surface. But with psoriasis, that process hyper-accelerates to a frantic 4 to 6 days. Because these immature cells race to the surface before they can properly shed, they pile up into thick, painful scales. Underneath, blood vessels widen to accommodate a flood of inflammatory cells. The visible flaking and redness on the outside is the direct physical result of a localized cellular traffic jam. When symptoms are mild, the initial strategy is a two-step process: clear the physical buildup and stop the redness. Step 1 requires chemical exfoliants, usually over-the-counter creams containing salicylic acid or urea. These ingredients melt away the dead cell accumulation, descaling the skin. Step 2 targets the redness. Dermatologists prescribe topical steroids to shrink those expanded blood vessels back to their normal diameter, removing the visible inflammation. But maintaining this cycle requires care. Relying heavily on topical steroids over long periods introduces a new physiological danger. Chronic steroid overuse can eventually damage the skin structure. The epidermis and dermis physically thin out until they resemble what dermatologists call tissue paper skin. Treating the surface symptoms alone ultimately ignores the deeper engine driving the hyperactive cell cycle. Psoriasis is a chronic, systemic immune response. The skin is the outward warning signal for a problem happening everywhere else. The exact same intense inflammatory markers visible on a knee or elbow are simultaneously circulating through the patient's bloodstream. That internal toll increases the risk for major organ complications, specifically cardiovascular disease, atherosclerosis, and liver dysfunction. The damage extends to the musculoskeletal system through psoriatic arthritis. It also takes a mental toll, frequently leading to depression and social isolation. This medical reality requires constant physiological vigilance to monitor and mitigate a cascade of internal risks. Because the body is already primed with a high baseline of internal inflammation, external stressors can easily ignite visible flare-ups. Lifestyle and chemical factors are immediate catalysts. Among these variables, smoking is one of the most aggressive exacerbators of the immune response. Internal biological triggers carry the same risk. A strep throat infection can spark a sudden, widespread outbreak of tiny psoriasis drops across the body, a variant known as Guttate psoriasis. The skin is so hyperreactive that dermatologists look for the Kubner phenomenon. This is where minor physical trauma, even a routine sunburn or a simple scratch, summons a brand new psoriasis plaque to the site of the injury. Controlling the condition means aggressively policing all potential systemic and external triggers rather than reacting to the skin after the fact. When psoriasis spreads to cover more than 10% of the body, local creams are often abandoned in favor of systemic solutions. One clinical option is targeted phototherapy. Patients step into specialized booths to bathe large areas of the body in light to reduce inflammation. Doctors utilize highly specific, superficial UVB light for this process. They avoid the deep penetrating UVA light found in commercial tanning beds, which accelerates aging and drives up skin cancer risks. For severe cases, modern medicine deploys its most advanced tier of treatment, biologics. This animation shows how these injectable medications operate as targeted assassins. They hunt down and neutralize specific inflammatory markers, like TNF-alpha, inside the bloodstream before they can trigger the skin cycle. Clinical advancements now allow doctors to shut down the inflammation at its source, clearing the skin from the inside out. Despite these scientific tools, the biological reality remains: psoriasis is uncurable. However, it is now highly controllable. With the right intervention, many patients achieve entirely clear skin. Reaching that state requires a holistic medical approach. Patients must coordinate with dermatologists and primary care physicians to monitor cardiovascular and organ health. Lifestyle optimization, like quitting smoking, actively managing your stress, and eating well, is mandatory. Contemporary medicine provides the tools to clear visible plaques and suppress internal inflammation, provided the patient targets the immune system directly rather than reacting to the skin alone.